Tonight we're taking a look at some of the ways coronavirus has affected Northeast Wisconsin. Here's NBC 26's Eric Crest.
It was in 2019, December 31st to be specific, when NBC 26 first reported on what we were then calling the novel coronavirus.
The coronavirus that they're seeing in China right now is a novel strain, and it is causing some more severe illness, and I think that's why it's getting the attention it is.
By January 21st, Wisconsin had its first confirmed case of the virus. Healthcare leaders at that point thought the risk to the general public in Wisconsin was low, but they told businesses to prepare for some major changes.
Employers may want to explore employees staying home and being able to work from home.
By early March, grocery stores were starting to witness the public's growing concerns.
Topic of the day, I guess.
People stocking up to avoid unnecessary trips and crowds.
More items than what they have in the past, but they're not claiming to be stocking up for the apocalypse.
By mid-March, healthcare leaders were sounding the alarm.
Northeast Wisconsin will see a number of cases increasing in the coming weeks, and it may increase dramatically.
Wisconsin's first 2 confirmed deaths related to COVID happened in mid-March, and then the Evers administration banned non-essential travel and issued the Safer at Home order.
Folks need to start taking this seriously, so today I'm asking for your help.
The move would impact just about every aspect of Wisconsinites' daily lives. It was a decision that was especially hard on small business owners.
We had kind of thought this was coming at some point in time, so we made arrangements from that standpoint that, we're shutting down essentially between 4:30 and 5 to meet the government mandate and go from there.
Now, during the order, positive cases of COVID started jumping 100% a day. Businesses were laying off employees and tried to establish curbside business models. And by mid-April, healthcare leaders were racing to set up COVID-19 testing sites.
Testing isn't to be a critical aspect to managing this virus long term?
By early May, nearly 500,000 people in Wisconsin were unemployed. Testing sites were sprouting up across the northeastern part of the state, and some businesses were opening back up for in-person shopping.
Expect that it's not the way it used to be. And if people can do that and, just give respect everybody's space, it'll be a good shopping experience.
The state Supreme Court struck down the stay-at-home order in mid-May. The summer was slow for many businesses, and parents would soon find out that their children's return to in-person learning would be up to school districts.
All of us are going through that. A lot of stuff we love has been taken away from us.
From August through November, COVID numbers across demographics rose in Wisconsin. Face masks at this point were commonplace, and hospitals were approaching capacity.
We're seeing the highest volumes of COVID patients that we've seen since the pandemic started.
Since the November record high of average new confirmed cases, the recent average of new cases is down 60% as of Christmas Eve.
You always want to celebrate when you see people not having COVID, and we're very excited about that.
And since statewide COVID-19 hospitalizations hit a record high in mid-November, the number is down 45% as of December 23rd. And as of Christmas Eve, the state reported 4,674 COVID-19 related deaths.
Most of the death we see in the hospital doesn't happen with COVID when you roll through the doors. It's people who have been in the ICU for weeks, even a month.
And now in December, 2 vaccines were approved for emergency use.
It feels like we have an answer, or we have some hope for an answer. So I'm hoping that we can all see it as that, get that vaccine and move forward.
In Northeast Wisconsin, Eric Crest, NBC 26.
It's been a long road. We'll hope for the best ahead. And still ahead here for us,